Welcome to Netsmart CareThreads, a podcast where human services and post-acute leaders across the healthcare continuum come together to discuss industry trends, challenges, and opportunities. Listen as we uncover real stories about how to innovate and improve the quality of care for the communities we serve. Let's get into the show.
Welcome, everyone, to today's podcast. My name is AJ Peterson, Vice President and General Manager of Care Guidance Solutions at Netsmart. Today's podcast topic is Connected Community Closing the Gap. I'm very pleased to be joined today by Dr. Holly Miller, Chief Medical Officer with MedAllies. She's been championing efforts across the industry to improve closed-loop referral technology, as well as drive greater provider adoption. So first, just to set some context around the podcast, it's our belief that interoperability and the seamless sharing of information should really always be at the forefront of the design of technology solutions and services for providers. Being able to further connect to all healthcare is vital to ensuring that the best health outcomes for individuals and for healthcare organizations to really thrive in any value-based care landscape that they may be navigating in. The healthcare IT industry has been really taking steps to improve clinical care delivery by implementing new interoperability standards that support the automation, specifically of closed-loop referrals, helping to streamline the ways primary care providers, for example, are informed on how they track their consumers and patients as they see specialists outside of their care setting. So really, providers benefit from being informed on a person's referral status as they refer and transfer care settings, and they can actually measure not only the progress, but also ensure timely access to care. At the same time, they're also responsible for tracking clinical outcomes as part of participation in these integrated care models. So the new standards will really focus on areas to improve overall referral management, closing the communication gaps, and really enabling transparency between care settings. So I want to bring in Dr. Miller into the conversation. So welcome, Dr. Miller, to the podcast. And I wanted to start, if you wouldn't mind explaining a little bit as a clinician, why this work around closed-loop referrals is so important and what's the value that you see to clinicians and providers alike.
Well, first, AJ, thank you for that kind introduction and to tell you that it's a pleasure to speak with you. But this is a topic that is probably the nearest and dearest to my heart because I can think back to the days when we would make a referral for a patient to see a specialist. 6 months later, that patient might be back in my office, or a year later, never having arranged an appointment, gone to see the specialist, and I wouldn't have known. My staff probably were trying to do their best to follow up, keeping spreadsheets of who'd been referred, but it was a manual process and very difficult to track. If the patient had seen a specialist, most often I didn't have the information from the specialist, so I'd be sitting there with the patient asking the patient, well, what did he or she say and what were the recommendations? What medications did they put you on? And the patient may or may not remember what that process was. So it really was very inefficient and not effective care. So with the incentive programs, we then were asked to perform electronic transitions of care. This was a tremendous advance. So instead of receiving paper or not getting information, I could both send information about my patient to a specialist I was asking to see my patient, and also receive back information from that specialist. A lot of the most important data, like diagnoses and medications, was being sent them as discrete data, so they could actually pull that data right into their own electronic health record and use it immediately. This eliminated transcription errors, and it saved time for the specialist and his or her staff. In addition, when they were completed with their work, they could send me the consult. And again, I could pull that information into my record, and I could keep up to date with what was happening with my patient. But this didn't solve the problem of tracking these referrals. 360X goes beyond electronic transition of care to really track the referrals. And actually, that's where the expression 360 comes from, because it's a circle. The first line starts the arc of the circle to the specialist, and then the second line closes that loop with my getting the information back. And at all points of the process, my staff will know, Did the patient get an appointment? Did the patient get seen? Did the patient no-show? So information is flowing to track the progress of the referral. So it's really a huge advance.
That's fantastic. So looking at it both from the perspective of how can I receive greater visibility to my patient or consumer as they're being referred into a specialty provider, but then also you touched on the clinical integration component of how do I take data and make it meaningful and actionable inside of my health record to really driving not only a workflow, but a knowledge flow on the person. So that is great context. So, if you don't mind, can you talk a little bit more about the 360X initiative? Kind of how is it organized, to give a little history around it? And then also who's participating? Who's participating in this 360X work group?
So from the inception, 360X is sponsored by the Office of the National Commissioner for Health Information Technology, fondly known as ONC. They sponsor this. They are looking to improve care transitions, specifically in the ways that we've already talked about. Since the inception of the group, 360X has input from a broad representation of various roles throughout the public and private sectors. These include clinicians, technical experts, and representation from many electronic health record and health information technology vendors, and obviously also with ONC representatives.
Excellent. And having such a wide kind of breadth of different organizations, both at the federal level, but then also at the individual HIT level, really helping to get support and legs around this initiative. So can you talk a little bit around, how was the industry planning to use this technology, or what are some of the high value use cases that you see this standard and this use case group being able to publish out to the broader community?
Well, initially, 360X was designed exactly as we've been talking about for specialty referrals. And since then, we've looked at some other high-value use cases. And those have included, very importantly, acute or ambulatory transfer to skilled nursing facility. This is something that happens much more frequently than people anticipate. There's a huge population of patients treated in long-term post-acute care. So having 360X in long-term post-acute care, we thought was critically important. Most recently, the group took into consideration the use cases that were so relevant to the pandemic, to COVID-19 pandemic. And those included taking into consideration thinking about all the patients, the morbidity that was going on in skilled nursing facilities and what we could do to help those patients in that process. So we looked at using 360X for skilled nursing facility to emergency department transfers. The other pandemic-inspired use case that the group has taken on is really acute and ambulatory referrals to social determinant of health needs, community-based organizations. We feel that with all of the changes in life situations for people affected by the pandemic, job changes, job losses, that this was something that would be critically important to address. I can tell you as a clinician, if I'm not thinking about my patient's social determinant of health needs, I'm really not treating the whole person. And let me give you an example. If I have a diabetic patient and I'm doing excellent clinical care, recommending that they eat a diabetic compliant diet and that they check their finger stick glucose regularly and that they take their medication. Well, if they're homeless, some of those things are probably impossible. So it's really important that I'm able to take the entire patient's situation into consideration and be able to make these critical referrals so that they can then address the needs in their lives as well as follow through with the clinical care that's required.
Yeah, I think you hit the nail on the head there. When we look at connecting the mind and the body together, it is so important that we're looking at both physical, as well as behavioral, and in this instance, social aspects of care. Because if an individual who is suffering from a behavioral health condition and a physical health condition can't find stable housing or food for their family, they're less likely to be able to follow through on the care plans or the medication regimens that the providers are prescribing for them. So taking into account the social aspects of an individual's health is important, and this is often a undigitized part of healthcare. So I applaud the efforts of the group to expand out the use of such an important tool as closed loop referrals to really start to incorporate the social service organizations that are so critical to the care of the individuals that we're serving.
Thank you, AJ. That's exactly right.
All right. So when we think about, who's participating and how our healthcare IT vendors coming together to really drive this from a work group standard into an actual production use. Can you share a little bit around where we are as a broader community in putting in a very critical tool like 360X into production use?
Great question. And as I mentioned, there are so many participants in the weekly 360X calls that really go across many EHR, HIT vendors. But I'm very happy to say that the following EHR vendors have said that they plan to release 360X either in 2021 or 2022. And top of the list, I think Netsmart already has released 360X, but Epic plans to release 360X. ECW has said they plan to. Matrix Care and No2 all plan to have 360X in production. Can I ask you, AJ, what has led Netsmart to participate in the 360X project?
Yeah, thank you, Dr. Miller. And we're proud to participate in this project because we see it as so critical as we think about how we digitize the community-based providers. And one of the key strategies to success from quality care, patient care delivery is how well we connect into the rest of healthcare, and being able to link our human service clients and our senior living and care at home clients to their referral partners on the health system side, acute and ambulatory physical health, is so very important. As we know, one of the most fragile times of an individual care journey is when they transition from one care setting to the next. So we at Netsmart look at this as a great opportunity from a technology perspective to help close that gap and create a more seamless transition of care that accounts for all of the individual's needs and creating a provider efficiency when a person is transitioning from one care setting to the next. So we look at this as a great opportunity for us to help the industry take a step forward as we care for individuals that move from their journey from acute to ambulatory into the community-based care provider setting. So maybe to kind of take us in for a landing, Dr. Miller, for our audience here, our podcast audience, what recommendation would you make to them in order to get started into thinking about electronic referrals, closed loop referrals, and transitions of care?
Well, I think the first step for anyone is to ask their electronic health record vendor, is this available? And if not, when will it be available? And if they don't have it on their roadmap, insist that it become available. And let me turn the question to you. How would your Netsmart customers at this point proceed? We've talked about all the organizations that are going to be, or all the vendors that will be live with 360X. How will the Netsmart customers plan this?
Yeah, great question. So we've made the 360X protocol available inside of our care records for specific communities. So clients that are interested in learning more about 360X can reach out to their Netsmart client representative and can talk about mapping a path forward to bring our clients live on the standard, but then also help us, as Dr. Miller mentioned, that other HIT vendors like Epic and others are looking for opportunities to link up community-based providers. So let's start the collaboration of looking at opportunities where we can implement and leverage the 360X standard in order to bridge that gap between acute, ambulatory, and community-based providers. So really excited to get the community engaged and to raise their hand to want to participate. So with that, I'm going to take us in for a landing. So Dr. Miller, thank you so much for joining me today on the podcast. And we look forward to continuing the great work the community is doing around closed loop referrals as we reimagine connected care in order to support the whole person. Being able to further connect all of healthcare is vital to ensuring the best health outcomes for consumers and patients alike, as well as the supporting provider organizations to thrive in new value-based care. So thank you again for your time on the podcast. And thank you again for your leadership in the community to bridge our provider communities together through the great work around closed loop referrals.
At Netsmart, we understand the challenges facing provider organizations. Our team will help you navigate changing value-based care models with solutions and services that make person-centered care a reality. We'll equip you with technology and services that provide holistic, real-time views of care histories that inform better decision-making and better outcomes. Visit us today at ntst.com. Netsmart, serving you so you can serve others. Thanks for listening to the Netsmart CareThreads podcast. Through collaboration and conversation, we can work together to make healthcare more connected than ever before and better support the communities we serve. To ensure you never miss an episode, please subscribe to the show in your favorite podcast player. If you use Apple Podcasts, we'd love for you to give us a quick rating for the show. Just tap the number of stars that you think the podcast deserves. Until next time.